response structures and mechanisms, we were informed that there was a body from a vessel, where that vessel originated from, where it was going. The details are not to our knowledge, but we know that the vessel did not dock in the DRC Congo. It came all through, and then on sea in international waters there was a body on board from which the samples were extracted. The body was brought onto the Liberian shore. Again, how that happened is not to our knowledge. Those are questions that we are asking ourselves. But what we did as UNFIL, the National Public Health Institute of Liberia, is to extract samples from that body, and in order to test those samples, since the information circulating from that MOH memo indicated suspicion of viral hemorrhagic fever, and suspecting Ebola or Marburg. In this country, we have had Ebola, particularly in 2014 when there was the outbreak in the region, which affected Guinea, Liberia, and Sierra Leone very severely. So these three countries don't take Ebola issue easy. We take it very seriously. You will recall there was the same VHF, viral hemorrhagic fever scare in Sierra Leone several months ago. They addressed it. They came out indeterminate, and definitely there was no contacts that died from that, except for the patient that was suspected. To this date, that particular case remains indeterminate. When it happened in this recent time in Liberia, the National Reference Lab, which is under the National Public Health Institute of Liberia, tested samples that were extracted from the body in Maryland. We tested those samples at the National Reference Lab. The samples came out negative for viral hemorrhagic fever, generally, suggesting to us that Ebola was not in there, Marburg was not in those samples, and Lassa was not in those samples as well. Those are the three big ones that we suffer from in the region. So we took that very seriously, as there were panic and pandemonium in the population. We received numerous calls at the UNFIL in our various inboxes and text messages in our various inboxes. The anxiety level was very high, as you journalists can attest to, because we received a lot of questions from you, and we ask you to remain calm. We, in this sense, want to really thank you for that cooperation that has continued to exist between UNFIL and the media, where you really rely on listening to us and not running with stories as it used to be in the past, for which during this Mpox outbreak we have had practically no miscommunication, no false reporting, and the international world is really crediting that relationship between the UNFIL, the Public Health Institute, and the media, how we've been able to establish that relationship, that we teach each other. So we waited, and we asked you to wait, and when the test results came out, the test results were negative. So negative for Ebola, negative for Marburg, negative for Lassa. We were not satisfied. We did a press release which we issued, from which you reported as well, in the electronic, print, and broadcast media. We were not satisfied. So as scientists in public health, diagnostics, and clinical issues, we did an extensive test, a second test, on the same samples that were collected, and on another set of samples that were collected in Nimba. This body has now been transported to Nimba. And so we did these tests on these samples again to repeat what we did, and this test came out negative again. At this time, this extensive test will specifically test for the different subtypes of Ebola. We have 4 major subtypes. That's the Zaire, Ebola Tai, Ebola restant, and Bujumbura. So those 4 major subtypes, we did not see them. So suggesting to us that our first test that we did, which didn't see any VHF at all, was plausibly correct. We did not see any Lassa. This second extensive test, we also specifically test for Lassa. We did not see Lassa. Then we also looked to see if the results show tells us anything about Marburg. We did not see Marburg. There are other VHFs, and I will not go through the whole list. We didn't see any of them. But we then reported that second extensive test that we did. To this date, those are the results that we have, and so we continue to ask the population to remain calm. We know how panicked all of you were. Remain calm, but continue to practice those public health measures that we promulgated during Ebola, during COVID, and even now during the Mpox outbreak. Currently, we are responding to 3 major outbreaks concurrently: Mpox, Lassa, and measles. So we ask you to wash your hands and sanitize your hands constantly. If you see rashes on any family member, any friend, please report that to the nearest health clinic. Please report that to the NFIL. We have been receiving lots of reports from you, what we call self-reporting, and we thank you very much for cooperating and for listening to us on the way we define what you see as Mpox, and you have been following those regulations and reporting cases to us. I received about 7 to 8 cases just over the last 36 hours or so. Other people received several other cases that were reported. So we want to thank you. What we understand is that some other samples were extracted by the WHO, and when those test results come back, when they tell us, we will let you know. We will be transparent with you. We will be accountable as we are accountable to you. The president of this country is very, very keen on accountability of his government and transparency in his government. And we who work in the various agencies are obligated to follow those tenets. And so we will continue to be transparent with you. If there's any problem, any death, anything that we can verify, we will let you know. To this date, our data for Mpox shows that we have 1,747 cases that were suspected. From that, we took 1,674 specimens. We tested all those 1,674 specimens. We saw that we detected 808 to be positive. So those 808 positive, out of this whole number, we have been treating them in their various homes and in an isolation center at Starbase. Out of that, 173 of them have recovered from the verified data that we got, and we tallied. 173 still remain active, whereby 635 have recovered. Again, out of 808 active cases or confirmed cases, 173 remain active and 635 remain recovered, and we have 0 death according to the data that we have, according to the verified information that we got. So that's where we are with this update. Again, once we get any information from any other test done, we will let you know. For we are still analyzing the rest of the results that we have to see what else could be in those results. And once we see anything, we will let the public know. thank you very much, and we have been reporting our findings and discussing with the appropriate agencies, the WHO, the US CDC, the Africa CDC, which is the Africa Centers for Disease Control, US Centers for Disease Control, AFINET, the entity that deals with training epidemiologists that go to do this disease detection, Red Cross, Prevail, NIH, UNICEF. We are all combining, and as we work on the One Health platform, we also cooperate and collaborate with MOH, with MOA, Ministry of Agriculture, EPA, and other line agencies. So we want to thank you and conclude at this point. Again, when we get any results, we will let you know. Or if anybody sends us any result from tests that they are doing, we will let you know. Thank you very much for your attention.
Yeah, so my name is Yanti Topa. Well, is there a challenge in terms of the mode of communication, giving specific reference to now you as an institution who is close with the authority to inform the public, especially with happenings, especially on this kind of matter. And when this case, a reported case of pandemic came about this Ebola, and this report was first given to the public by the Ministry of Health, and then you as an institution, when the media reach out to you and you ask that the media should hold on until you do the necessary investigation, do the different testing and what have you. Is there a challenge in the mode of communication? At this stage, who do we believe? When we see information in the public now, we will see on the Ministry of Health is reporting another thing, and then the National Public Health Institute reporting another thing, and that's something that gets the public confused in terms of the information. How do you respond to that?
Thank you very much. How we cooperate, how we collaborate has to do with our specific terms of references, and it has to do with our fiduciary duties according to how we were established. The National Public Health Institute was established to respond to public health threats, actually health threats in general, be it something that is clinical that will become and get prevalent, meaning widespread. The National Public Health Institute, as a research and scientific institute, can respond to that. How other entities respond, how they do their work, is not within our purview. And that is why when this issue came up, once we knew that that body was on the Liberian soil, and we got the information from wherever that it was suspected of being infected with VHF, viral hemorrhagic fever, which include Ebola and Marburg, our duty was immediately to activate our response surveillance arm. And they went immediately, took samples, because that's the first thing we do, to confirm whatever information we got or to rule out. And so we did play our part, and hopefully that helped. When that result came out, that helped to allay the fears of the population and calm the population down, to reduce the panic. And consistently we are doing that so that the public is aware. The National Public Health Institute, since we took over this administration, have built the capacity to respond to these threats. We have built up our laboratory capacity so strong now that we are able to detect and know exactly what we are looking at. You saw the recent publication where we discovered here that we have Mpox, monkeypox, but then we look for the specific type, and we found that we have Mpox clade 2A, and we are responding to clade 2B, which will be published later also. So thank you.
Yeah. So basically, my question is I'm Bill Cooper from Inquirer newspaper. It's a follow-up to my colleague question, but in a different form. I'm concerned about the relationship between the MPhil and that of the Ministry of Health. How the relationships like? And then follow-up to that, are you threatened by the information at times coming from the Ministry of Health, taking into consideration what happened with your predecessor, that the Musoka Fala and the former Minister of Health, Dr.